All smiles as usual. Good morning, Dr. Denise.
Good morning, guys. How are you?
Fine,
You
thank you.
guys are always looking very fresh. Me, I always look very tattered and very high, very stressed out.
Admiring you from here, we sometimes feel like just pulling you down here with us.
Yeah, that's wishful thinking.
All right, so the floor is yours. Let's know your topic and what. Go ahead with your guest there.
Alrighty. Thank you very much. Good morning, viewers, and welcome to another edition of Kakaki Cancer Awareness with Denise Ejo, the CEO of Common Cancer Foundation in partnership with AIT. Together we fight, together we win. We thank you all for championing our cause. 2025 gives us another chance, and I'll keep saying it. The future is in our hands, and God is faithful. So let's go. What are we talking about today? Beyond survival, addressing the emotional and financial burden of childhood cancer. And today I'm very privileged to have two very unique people. I use the word unique because I've been hosting this for how many years? 4 years, and this is the first time I have actually been able to get a cancer patient, a childhood cancer patient, and a doctor. So, good morning. Who do I want to say hello to? Dr. Sheyi, thank you for honoring me. And it's very strange that I was able to find you, and then I have my children sitting next to me, and she goes, my consultant's name is Dr. Sheyi. Fantastic. Good morning, Dr. Sheyi.
Good morning, Dr. Ejo. A
How are you
pleasure.
doing?
I'm very well, very well. Good morning.
Chidera, our superstar, our childhood cancer survivor. How many years ago did you have cancer?
13 years ago.
13 years ago. You're looking good. We thank God. Gosh, God is good. Thank you all for joining us. As you see, I've got two very interesting people here with me, very dear to me. So let's go. So, what's it about childhood cancer? And that's what we're going to be looking at focusing on. And hence, we have a childhood cancer survivor 13 years on. Every year on the 15th of February, the world unites to raise awareness and express support for children and adolescents with cancer, their families, and their survivors. This week, International Cancer Day 2025 will be on the 15th, which is I think on Friday, on Saturday. And it's a reminder of the urgent need to improve access to quality care, emotional support, and financial assistance for young patients. So this year the theme is Better Survival is Achievable, emphasizing that through global solidarity, early diagnosis, and accessible treatment, every child can have a fighting chance at life. So we can see with our survivor sitting here, Miss Chidera. I cannot pronounce your surname, so you're going to do that for me yourself so that I do not damage the way we say it. Please, can you help me?
Good morning, everyone. Good morning, viewers. My name is Chidera Iwerem.
Ewerem. Good. That was not that bad. Why did I think it was hard? So in Nigeria, childhood cancer is a growing health crisis. According to WHO, World Health Organization, approximately 400,000 children are diagnosed with cancer globally. In Nigeria, late diagnosis, lack of specialized treatment centers, and the high cost of care contribute to the alarming rates of low survival rates. So let's jump into this conversation as I quickly introduce our guest. Chidera is a childhood cancer survivor who was diagnosed with osteosarcoma in 2012. Today, I am privileged to have her and her consultant, as I said. She is a physician, and she has had a leg amputated, which happened a year after her diagnosis as a result of her cancer. And in our house, so Chidera, thank you. I really applaud you. You're still here, you're fighting, and you're looking good. And we can only thank God for you. So today we're going to hear from you. And in the house, we got Dr. Sheyi Dowu, who is an orthopedic surgeon with a special interest in orthopedic oncology. He attended the Institute of Translational Medicine, University of Liverpool, where he actively participated in identification of biomarkers of sarcomas. He is also a recipient of the Orthopedic Oncology Fellowships at the Royal Liverpool University Hospital and Royal Orthopedic Hospital, Birmingham. He is a member of the Lagos Mosque. Oh my God, this is where we always have a problem. No, I'm not even going to try it. Oncology Network. Doc, you're going to help me when we get to that word. Please, can you please say it?
Lagos Musculoskeletal Oncology Network.
Guys, you see why I respect myself? If you see the word is like 15 letters, only me one, not this early morning. Perhaps the first in multidisciplinary tumor board for bone and soft tissue tumors. So thank you all for joining me. Let's sit back and remain united against cancer as you join me on this conversation with my guests. And I'm going to start with Chidera, and I will refer to as Chidera throughout the conversation, and Dr. Sheyi, even though he's actually Dr. Ido. It's Dr. Sheyi to me. So can we go? Chidera, can you please share your inspiring story of survivorship and how you overcame the odds, considering you are a childhood cancer survivor?
The journey started 2012 when I was in school then. I went to school. I was playing with my friends. Then by mistake, I hit my leg against the desk. So I wasn't staying with my parents then. I was staying with someone. So when I got home, I didn't tell them that I had dislocation in school. I was just managing it. So then the woman I was staying with, then we were going to church. So she noticed I was limping. I only told one of us that is staying together. So she was just using ice block on the leg to help me massage it. So when the woman noticed I was limping, she was like, "What happened?" I said I fell in school. She said, "You couldn't tell me." I was like, "I thought it was something small." So she gave me drugs for pain relief and they were massaging it. And I was actually getting better then. Then, like 4 days after, we were at the parlor because I stayed with a pastor. So we were reading our Bible. I slipped and fell down in the bathroom. So I still hit the same spot which I hit in school at the door of the bathroom. So it was something bad, like big time bad. So they had to call all the traditional bone setters to do it immediately. That's when I started the procedure for 3 months. And there was no improvement at all. Still at a place, I was not moving the leg, it wasn't healing. So my mom had to come and ask them that there's someone in that, because then I was staying at Okota. My mom had to come because she stay at Ajegule. She said there is somebody in Ajegule that is really good in all this bone traditional way. So I was moved from Okota to Ajegule to continue with the treatment. For that 3 months in Ajegule, there was a little bit of improvement because then I was using crutches. But I was still feeling so much pain on the leg. I was walking, but I was feeling pain. So if the woman comes, I'll still be crying. And she was like, "This is up to 3 months. There should be a lot of improvement. I just get feeling pain." So she had a nurse that she was working hard with. So the nurse said I should do X-ray first. So when we went to do X-ray, the picture, the bone was blank. There was no bone there. So the nurse was like, "She can't interpret this, so that we need to go to the hospital because she's not even seeing the bone. She doesn't even know if it's healing or if it's joint back. So we should go to the hospital because the picture was blurred." So when we went to um Boundary, there was no hospital there. From there, the doctor directed us to Bagada, that we should go to Bagada General Hospital. So when we went to Bagada General Hospital, we were just running tests for a month, different tests. After all the tests, he said, that is bigger than him. We should go to Ibobi. that's where we'll see who will teach me. Then they to run the same test we run there. When I came, that was when I was told that it was cancer and it was already in stage 4. It was like because the leg was too big, it was swollen. Then that was when we met Dr. Idowu. He was my consultant and he told my mom. My mom refused. She didn't believe it. She was like, my daughter, she's small. Why will she have cancer? So my mom took me out of that hospital. We went to church. We stayed in that church for some weeks, almost a month, in one camp. I've forgotten the name, but it was a camp. So we stayed there. There was no improvement. They were still carrying me. I was not walking, and the leg was swollen. So when it was really serious, we had to go back to the hospital. And when we came back, I remember we met one doctor, Dr. Joseph, before we met Dr. Idowu. It was like, you people are using this girl life to play. Why are you risking your daughter's life? Then the doctor said, my girl, you have cancer. He was talking to me and we need to give you chemo. I will amputate your leg so it will spread. I was like, okay, no problem. So the doctor was like, he was telling my mom that you see, your daughter is even giving her consent. Why are you not taking her up and down? Why do you want to kill her? That if this girl died, the blood will be on your head. So then, to me, I was able to survive the odds because I'm a happy girl from childhood, like from baby, I've been happy. So I don't believe in all this kind of thing that it will weigh me down. So happy, you have to take it, it's so fresh. I was glad I'm alive. So I was like, yes, no problem. That was when we started undergoing chemo in Igbobi. And the first stage of the chemo was so expensive, like big time. It was really expensive. That was when Dr. Idowu said he will introduce us to a doctor that do come here. She's an NGO. She gives chemo. She assists people in giving chemo. She was Dr. Nneka Wobi. So he introduced us to her. And since then, she was not supplying us with the chemo for the treatment and supporting us financially because then it was really expensive. I was young, but I know that my parents was going through a lot in that period because before taking the drip, I have to take 2 pounds of blood, drips, and many other things. So, and I took the chemo for 9 good times. I took it 7 times before the operation and 3 times after the operation. So, Dr. Nneka Wobi was really a supportive system then for me and friends and family. That was how I, that was how I went through that stage.
Fantastic. Dr. Idowu, I'm going to come back to you now. And actually, let's give all kudos to Dr. Neka. Dr. Neka, that's Children Living with Cancer Foundation. That's who Dr. Neka Nwobi is that she's referring to. So we want to say thank you, Dr. Neka, for actually taking on this child. Dr. Shei, you remember your patient?
Oh, very well. I remember Neka very well. Chidera very well. It's good to see you. She's really a happy woman now. She was a happy child. She was also a happy child. I remember very well, and I remember Mom. It's just one of those stories when devastating disease like cancers affect people, especially young people. It can be quite traumatic. But I do remember.
I'm sure you are very happy that she's one of your happy stories.
Oh, very. I mean, it's emotional for physicians as well, where you see people do well, especially in an environment where people present very late, and of course, it becomes very challenging eradicating diseases like cancer. But when you do have patients who benefit from the treatment, it's really quite, it's rewarding, emotionally rewarding, both for the patients and the caregivers. And I must say all kudos goes to my colleagues, both the NGOs, mentioned Dr. Nek and Wabi, and people like her who are doing tremendous job. There are good Nigerians who indeed take on the responsibility of looking after all the Nigerians to make sure that when they're in need like this, things get better for them. And I must thank all my colleagues at the Lagos Musculoskeletal Oncology Network. You mentioned that before in your introduction. So we work in collaboration. There are people who specialize in giving the chemo and radiotherapy. Our beats sometimes surgeons is just to make diagnosis and probably do surgery or reconstruction if we can do that.
Thank you. Anyways, I just felt it was very great for me to be able to have the two of you online. I don't think you've seen yourself in a long time. Anyway, let's go on to this now. What are the most common types of childhood cancers now in Nigeria, and how can parents recognize the early signs, especially when we look at Chidera's own experience, which had to do with her bone?
All right, thank you. So the common cancer. So let's remove the myth that children can't have cancers. It does happen. It's just that children are particular, like you've said, common cancers that affect them. One of the common ones I just listed are the blood cancers, which we call the leukemias, the lymphomas. Then there's a condition called nephroblastoma, which is otherwise called the Wilms tumor, or the retinoblastoma, which is an eye tumor. And of course, the sarcomas. So the sarcomas are the bone or skeletal tissue, which is a supporting tissue tumors. And a certain type of them, like the osteosarcomas or rhabdomyosarcoma, tend to occur in children. Reasons have been adduced include the fact that they're growing and cells are, rapidly dividing, which may give rise to errors in that division and allows for cancers to develop. In terms of questions or what parents can look out for, one of the first thing is what Chidera has mentioned in her story, which we call the red herring. You don't see a red herring. Something doesn't look right. It's better to look at it properly. So she first said the first thing that she thought that she'd injured herself and developed a bump. Of course, typical child, you didn't want to confess at home so that you won't be scolded. So what I encourage parents to do is not to ignore any bump or swelling on any part of the body. It's not there before. It needs to be checked out by a qualified medical practitioner so that they can tell you whether it is something you need to be worried about or something that needs further investigations like x-rays, scans, and maybe advanced diagnosis techniques like biopsies to determine what's the nature of the problem. Other things that you should look out for include unexplained weight loss. A child is losing weight unnecessarily. Children are developing yellowness of the eyes, things like that. They're not generally well. I think that's the time to get your family physician to look at this child properly and then run some tests and see whether it's something that we need to be worried about. At this point, I must mention the menace of traditional bone setters because that sort of makes things a little bit more difficult to diagnose. If you don't go to the proper setting where appropriate investigations can be done, it may be difficult to make the diagnosis of these conditions because a lot of them mimic just fractures, and then you think it's just a fracture of the bone, but it's beyond an ordinary fracture. So the kind of fracture you get with cancer is what we call pathologic fracture, which is a fracture due to the bone not being healthy. So it's different from the fracture that happens because children are falling off and they've broken their bone ordinarily with some force.
So basically, in short, once you have a fall, we need to now stop going to this traditional, especially if the child has fallen down a few times. For instance, let's look at bone, for instance, but it's not just bone, but in this instance, it was about a bone. And if they had gone to the hospital on time, we would not have gotten as far as getting her a leg amputated, right?
Yes, so it's unfortunate that Chidera had to have an amputation. So the standard thing would have been if we were able to pick it up at an early stage, you can actually get the chemotherapy and still have that aspect of the bone. So the aspect of the bone that is affected, in that case, I think it was the distal femur. We would have been able to take that out and do some reconstruction. Sometimes nowadays you use metal to replace them, which you call an endoprosthetic replacement, or a grafting. You can take bone from another part of the body and use it to reconstruct that portion. And with time, it sort of heals up and people are able to walk around. There are people who are moving around with that all over the world, even in Nigeria. But it depends on the stage at which that cancer is diagnosed. If it has not spread to involve the soft tissues and damage the muscles and the skin, that can still succeed. When you have extensive destruction that is culminating in infection,
therefore, is mental health.
it's extremely important. The mental health of the patient is extremely important. I must commend Jada for being so strong. She's always been a very strong young woman. And it's a challenging period, both for the patients and the family. Now, ideally, we work with people who are able to do psychological counseling and support families. Of course, like I mentioned earlier, there are NGOs who also provide a lot of support for the families and for the patients to make sure that they are not overwhelmed with the trauma of the illness. It's quite challenging on overall on everyone all around the patient. But of course, like I said, the best thing is to get professional support so that it doesn't become too much for the patient.
So now, if we're looking at it, when you look at the support, we also have to recognize that when we're talking about mental health, there is also the family, there are the people around them, and there is the impact of what happens in schools. How do we educate people about that? Because she's strong, but how many people are strong? And how many people would carry it the way she did? And how many children don't make it because, for one reason or the other, they really can't go. They can't navigate this.
So I think the easiest way the easiest way I explain illnesses to people and perception to illness to people is that anybody, even myself, can be a patient at any time. I mean, we're all mere mortals. So I think one of the things you mentioned, school particularly, is that yes, it can be taught in school to make sure that when it might be quite challenging because people get scared generally about things that
We're looking at here is how I want you to, what message of hope with other Nigerians battling childhood cancer, their families, just give them maybe just something to hold on to.
Okay. Thank you for the opportunity. Well, my message of hope, just like I said, I was a strong girl, but it doesn't mean that I wasn't affected. Like, it didn't affect me in an emotional way, like I was just happy because I'm a strong girl. This kind of um, illness just comes to me, taking one part of my body. Yes, I'm a strong girl, then I'm happy. No, it wasn't actually easy. The strength I had there was just to accept it that I will be alive. That was one of my strengths. But it was not actually easy. Like I was just happy with the change because this is a big change. Because I remember then when I was young, because I was 13, then I remembered everything because I was in JS2. So I remembered everything. I remember having friends. I remember working. I remember wearing clothes I love to wear. So the what I would have to say that I had to take it bit at a time. Like I live every day, just a step at a time. It was not really easy, even with the fact that I was happy girl. I could I could accept that fate of my life and just move on. But it was not easy. Even down to date, I'm still living each day. But the best, what I have to tell them that there's life, like there's more to achieve. So you should not use because of this illness and just give up on life because there is more to life. I had to go back to school, even though that my classmates they were two class ahead of me because I had to go through this my treatment for 2 years. So my classmates were two class ahead of me, but I had to still stay back and know that there's still more to life. I had to continue learning. After finishing school, I had to learn skills because I didn't pass my jam then. So I just said, let me just go and learn skills. So I've been living because I'm actually fulfilling my life, which is the work I learned, and I'm working and making money from it. So I just believe that what I have to tell them that there is more to life. So you should not use one particular illness to just define your life and just live in the state of helplessness because there's more to achieve. And people are looking up to you because your strength, which you possess, will determine how people will relate to you. Because then I have friends that they'll be like, "Hey, Claire, please sit here. Don't stress yourself." I'll be like, "Leave me. I'm not stressing myself. Leave me. I don't send you to be looking out for me." Because if you are giving yourself that pity party state, they'll be giving you what kind of
Our message is very clear. Together we'll fight. Together we win.